Hey everybody, welcome back to our YouTube channel. My name is Ashley Agan. This video is going to focus specifically on surgery of the eustachian tube. And specifically, this video will be surgery for dilatory eustachian tube dysfunction and Baro-Challenge eustachian tube dysfunction, which is essentially, these are conditions where the eustachian tube is having trouble opening. And so there are procedures we can do to help the eustachian tube open better. And that's in contrast to patulous eustachian tube, which is a problem where the eustachian tube is kind of stuck open and isn't closing well. And so I'm going to do a different video for that one because the treatment is exactly the opposite of what we do for dilatory or Baro-Challenge eustachian tube dysfunction. Okay, so first up, obviously patients will see me in the office. We'll look at the eustachian tube, we'll look at the eardrum and kind of figure out what's going on. In the patients who have dilatory eustachian tube dysfunction, that means they're having a blocked eustachian tube. The eustachian tube is having trouble dilating. So there's dilatory dysfunction. And the eustachian tube is a valve, meaning that it opens when we swallow or yawn, usually without us realizing it throughout the day. And then it closes back together. In some patients, it's even when they swallow or yawn, or they try to pinch their nose and force air through, they can't do it. And as far as dilatory dysfunction goes, the most common reason for that is that the lining of the eustachian tube, which is called mucosa, it gets inflamed or swollen. And so even though those muscles are moving and trying to open the eustachian tube, it's not opening. And if it can't open, then the air can't pass through to equalize the pressure between the middle ear, which is behind the eardrum, and the back of the nose and throat. And so the surgeries that we do in this area are meant to help open that eustachian tube up so that air can pass through. And so when I'm looking at patients' eustachian tubes on exam, I have a scope that's going through the nose and looking at the opening of the eustachian tube in the far back of the nose. And I'll have patients swallow or yawn, and that's showing me how the eustachian tube is attempting to open. And my scope is looking right down the lumen of the eustachian tube so I can see whether or not there is swelling or mucus, or if there's trouble opening, or sometimes there's so much swelling that I can't even find the opening, or so much mucus that's just draining back from the nose that you can't even see the opening. In the patients who have Baro-Challenge eustachian tube dysfunction, so these patients are fine except when they are pressure challenged. What does that mean? When they go up in an airplane and their eustachian tubes need to open to help equalize the pressure, they can't, and so they're uncomfortable. Particularly when the plane is landing, they'll feel pain or pressure because the eustachian tube is having a hard time opening to help equalize the pressure. Or when they're diving, I had a patient who had aspirations to get their SCUBA certification and was having a really hard time being able to equalize the pressure, and so couldn't get down to the depths that they wanted to when they were trying to get that SCUBA certification. When those patients are not when they're not diving, when they're not flying, they are fine. So in the office, frequently they have no symptoms. But when you look at the eustachian tube on exam, commonly there is just a little bit of what we call edema or swelling along the inside of the eustachian tube. So those patients are also good candidates for potentially eustachian tube surgery. Okay, so let's get into what surgeries what tools we have to offer. Obviously, we always start with conservative measures. And so surgery is for patients who have already tried everything else and they're at a point where they're ready to do more. The most common surgery that we do for a blocked eustachian tube, so dilatory dysfunction or Baro-Challenge, is called the eustachian tube balloon dilation, or some people call it balloon dilation of the eustachian tube. But it is basically where we go through the nose, have a camera and a balloon catheter through the nose, slide the balloon up into the lumen of the eustachian tube, and then blow it up for 1 to 2 minutes, depending on the amount of inflammation, and then let it down and remove it. This can be done in the office under what we call local anesthesia, meaning numbing medicine inside the nose, or it can be done in the operating room under general anesthesia where patients are completely asleep. And it is a relatively quick procedure. So once the balloon is in place, up to 2 minutes, and then you take it down. And essentially what is happening is that balloon, when it blows up, it is squishing that inflamed mucosa. And it creates, when you look at that tissue under the microscope after you do a balloon, it creates a crush injury of that mucosa. And then when the cells of the body come in to clean it up, they will put down normal mucosa in its place. And so when you look with the scope before and after, that after mucosa looks smooth and not inflamed. And so with this procedure, there is typically a delay in when you will see results. And so, for example, if we do the procedure, patients, we may not notice a huge improvement for 4, 6, 8 weeks, something like that, depending on how things are healing and what else they might have going on. And so it's not as instant as something like ear tubes. Like if I put in an ear tube in the eardrum, usually those patients will notice improvement instantly. So you don't get that instant improvement. But the surgery itself is very effective. It works very well for the patients who have that Baro-Challenge eustachian tube dysfunction. So the patient I was referring to earlier that wanted to get their SCUBA certification, they had the procedure done. Now, a year later, they let me know that they were able to get it and they are living pain-free as far as it relates to any sort of pressure-related activities. Shortly after the procedure, they had also noted that they were able to take a flight and their ears didn't start hurting as soon as the plane was starting to make its descent. So a lot of patients will say they know the plane's starting to land before then the pilot comes on to say, we're making our descent, because their ears will tell them because it starts to hurt. So this patient was just so excited that they didn't notice that pressure change because their eustachian tubes were working better. So that's always really a fun outcome to be able to give somebody. I think eustachian tube dilation in particular is a really great tool for the Baro-Challenge patients. Those patients tend to do very well and have high success rates, and the procedure tends to last a long time for them. With patients who have dilatory eustachian tube dysfunction, sometimes the results can be a little harder to predict. And part of that is because the underlying cause of dilatory dysfunction can be varied and can be multifactorial. So what do I mean by that? It could be like the reason for them, the reason for them having the inflammation of the eustachian tube, it could be that they have allergies that are uncontrolled. So lots of respiratory allergies like allergic rhinitis, or maybe chronic rhinosinusitis. So they've got inflammation in the nose and sinuses that is ongoing. And so what I have seen sometimes with those patients is we do the dilation and they may have an improvement in the short term, but if they're not treating the allergies, like if they are feeling good and they say like, oh, I don't need to take my allergy medicines anymore, I'm fine, then slowly there's this creep where they will float back to their baseline where they were before you did the dilation. And so it's really important to continue treating whatever that underlying inflammation is in order to have more lasting results with the balloon dilation in that group of patients that have dilatory eustachian tube dysfunction. I hope that makes sense. Other tools that we have at our disposal, for some patients, there is, particularly in younger patients, there may be what we call adenoid hypertrophy. That's blocking the eustachian tube. And so in the very back of the nose, on the back wall, that's where the adenoids grow. And the adenoids are related to the tonsils. It's a similar type of tissue, and they're very large and active when we are young because they're part of our immune system. And then they tend to wither away and get smaller as we get older. But in some patients, that tissue can stay enlarged and it can actually block the opening of the eustachian tube. And so in those patients, performing an adenoidectomy, which is usually done in the operating room where we shave that tissue down or cauterize it down, can be really helpful because it's essentially just completely blocking the opening of the eustachian tube. And so obviously if you remove it, then the eustachian tube can actually function. And sometimes you might pair those together. You might do an adenoidectomy, and then when you're able to see the lumen of the eustachian tube, you might say there's a lot of inflammation there. So we use the balloon to treat the inflammation that's on the inside of the eustachian tube. And that way you're kind of treating both of those at the same time. And so those procedures tend to pair very well together. And so that's it as it relates to surgery on the eustachian tube itself. The big take-home points, this surgery is for patients who have dilatory eustachian tube dysfunction. So that's a blocked eustachian tube that's not opening, not working for them, or Baro-Challenge eustachian tube dysfunction. So patients who have trouble when they are flying or diving. It's a quick procedure. It is indicated for patients as young as 8 years old right now is the youngest that the FDA indication is for. And they can be done quickly and safely in either the OR or in the clinic setting. Let me know if you have questions. Go ahead and put those in the comments below, and I will make a separate video speaking about patulous eustachian tube since that has a different surgical approach. I hope you found this helpful. Click that like and subscribe button, and I will see you on the next episode.